Hemorrhoids are a disease in which varicose expansion of the rectal venous plexuses occurs, often accompanied by periodic bleeding, a foreign body sensation in the anus, swelling or incomplete emptying. As the process progresses, the nodes may fall out, become compressed, or thrombus. The following types of diseases are distinguished: acute hemorrhoids that are clinically characterized by thrombosis or compression of the hemorrhoidal node with rapid inflammation. Chronic hemorrhoids have 4 stages, of course. In the first stage of the symptoms, only bleeding occurs, which is manifested by the presence of a mixture of red blood in the stool during and after defecation. B. In the second stage, hemorrhoidal nodes are observed, which can still be repositioned independently. The secretion of mucus irritating the mucous membrane of the anus is also noted. C. In the third stage, the fallen nodes do not repair on their own. The patient has to do this with their hands. D. And at the fourth node, it is no longer inserted together with the anus mucosa. In this case, a chronic inflammation develops. Constant bleeding and incontinence may occur. Manual adjustment of such nodes is difficult and often ineffective, as they fall out again in a short period of time. Hemorrhoids are treated medically and surgically. The first option is used as an independent therapy in the early stages of the disease, and in cases of exacerbation of the chronic process to relieve pain and inflammation, surgical manipulations are recommended at any stage outside the acute phase of the disease. Drug treatment of hemorrhoids. Drug treatment of hemorrhoids involves prescribing medications that reduce pain, inflammation, and improve trophic processes in tissues. Such therapy is used by the patient independently at home, but as prescribed and under the supervision of the doctor. So the task of treating hemorrhoids at home becomes removal of the inflammatory reaction, pain relief, elimination of thrombosis, cessation of bleeding. Let us dwell on each problem in more detail. Elimination of inflammatory process. To eliminate the symptoms of inflammation, systemic or locally, acting medications containing NSAIDs and glucocorticosteroids are used. Of the systemic drugs, diclofenac and zefacam are more often prescribed. From the local ones, there is a steroid containing urobilin. Pain relief. To relieve pain in hemorrhoids, nonsteroidal anti-inflammatory drugs and local analgesics are also used. As a rule, they are combined preparations containing 2 or more active substances. Among NSAIDs, proctoglivenol and nigapan are indicated. In addition to their anti-inflammatory activity, they normalize vascular tone and reduce the severity of congestive phenomena in the cavernous bodies of the anus. Medicines like Emla and Cadogal contain lidocaine, which acts much faster than NSAIDs. They are used for severe pain, thrombosis elimination. Heparin has a pronounced thrombolytic effect, which is used in hemorrhoids in the form of ointments and gels as part of mono and combined preparations. Combined medications which, in addition to heparin, contain steroids, panthenol, and lidocaine polycanol, have proven themselves well. They quickly suppress pain syndrome, lead to the regression of thrombus-induced nodes, have a powerful anti-inflammatory effect, and stimulate the regeneration processes of damaged tissues. Bleeding cessation. To stop bleeding, collagen and alginate hemostatic sponges, impregnated with fibrinogen and thrombin, hemostasis factors involved in blood, clot formation are used. Such sponges are inserted into the anus, and upon dissolution, lead to the formation of a fibrin film on the surface of the node, blocking bleeding. Folk medicine in treating hemorrhoids. From folk remedies, cool sitting baths based on herbal infusions can be beneficial. They can somewhat relieve pain, relieve itching and irritation, but there's no need to expect serious and lasting effects from them. Bathtubs are contraindicated for hemorrhoidal bleeding. Read more about folk remedies for hemorrhoids here. Diet for hemorrhoids. Diet for hemorrhoids is more directed not at the disease itself, but at normalizing digestion. Its purpose is to eliminate constipation and diarrhea, which exacerbate the course of hemorrhoids. To eliminate constipation, it is recommended to enrich the diet with foods rich in dietary fiber, vegetables, fruits, and porridges. For a tendency towards diarrhea, rice, water-based porridges, kissels, and low-fat soups can be beneficial. In both cases, it is not recommended to consume spicy, salty, and fatty foods. More about eating for hemorrhoids. Physical activity and gymnastics. Hemorrhoidal gymnastics is aimed at normalizing venous outflow from the cavernous plexuses and eliminating venous congestion in the pelvis. Kegels exercises, in which it is necessary to alternately pull and relax the muscles of the pelvic floor, including the anus, have good effectiveness. Regular cardiac exercises are also beneficial. Running, walking, swimming. Lifting heavy weights is strictly prohibited, and cycling and equestrian sports are not recommended. Currently, there are many effective comprehensive remedies for treating hemorrhoids at home. They contain medications with different pharmacological effects, allowing the use of a single medication to immediately eliminate the entire symptom complex of hemorrhoids. However, we draw your attention to the fact that only a doctor can properly select such a preparation. Self-treatment is unacceptable.